Hello, my dear students. Our today's topic is rickets and its identification. Rickets very interesting topic because it has lot of science, important science which you have to remember. So let us start. First, we have to start how the vitamin D is activated. How there is a formation of 125 dihydroxycholecalciferol. In the skin, there is 7 dehydrocholesterol, which, with the help of sunlight and ultraviolet sunlight, which is more present the sunlight in the morning, it is converted to cholecalciferol, which is vitamin D3, and this is inactive form of vitamin D3. Then this cholecalciferol reaches to the liver, and in the liver it is converted into 25 hydroxycholecalciferol. 25 in the at place of the 25th carbon atom there is addition of a hydroxy group. Then in the kidney, with the help of parathormone, which is released from the parathyroid gland, there is at the number 1 carbon atom, again there is addition of one more hydroxy group, and it is formed 125 dihydroxycholecalciferol or 125 DHCC, which is the active form of vitamin D3 in the kidneys. This is the active form of vitamin D. What does it do? It helps in calcium absorption from the intestine. So this calcium comes into the blood, and 125 dihydroxycholecalciferol or vitamin D, active form vitamin D, is responsible for increased blood calcium. This is another chart. GIT, diet, feces, urine, extracellular fluid, bone. So this parathormone increases blood calcium level by resorption from the bone, by increase the reabsorption from the kidney, and indirectly it helps in the formation of 125 dihydroxycholecalciferol. Calcitonin has reverse effect. It decreases blood calcium level by increased deposition on the bone and increased excretion through the urine and decreased absorption from the GIT. And vitamin D helps to increase the blood calcium level because it helps absorption of calcium from the GIT into the extracellular fluid, 125 dihydrocholecalciferol. So 125 dihydrocholesterol, the active form of the vitamin D, increases the absorption of calcium from the intestine and also increases absorption of phosphate from the intestine along with the calcium. This is the action of dihydrocholecalciferol 125. So applied aspect in the rickets, if there is deficiency of vitamin D, then there's formation of rickets in the children. And if in adults there is deficiency of vitamin D, then there's formation of the osteomalacia. We'll discuss rickets in this video. Rickets, what are the causes of rickets? Rickets is the bone disease in the children characterized by inadequate mineralization of bone matrix. It occurs due to vitamin D deficiency, and vitamin D deficiency develops due to number 1, insufficiency of vitamin D in diet. Number 2, inadequate exposure to sunlight. Number 3, in GIT disturbances such as sprue, malabsorption, chronic diarrhea, hepatic disorders, obstructive jaundice, pancreatitis, renal disorders, there is also the renal rickets, prolonged lactation and frequent pregnancy, and insufficient mobilization of calcium and phosphate. These conditions are responsible for vitamin D deficiency. Then features of the rickets. There may be stunted growth. The skull, there may be odd shape to the skull and stunted growth of the child, baby rickets symptoms complication. Next, there may be collapse of the chest wall, odd shaped prominent skull, and then collapse of the chest wall due to flattening of the sides of the thorax with prominent sternum, and the deformity is known as the pigeon chest deformity. यहाँ पर एक पिजन चेस्ट डिफॉर्मिटी बन जाती है और इस साइड्स में बिल्कुल कोलैप्स कर जाते हैं ये थोरेक्स. देन रैकेटिक रोजरी, विजिबल स्वेलिंग्स वेयर द रिब्स ज्वाइन द कार्टिलेजेस. यहाँ पर रिब्स हैं और यहाँ पे कार्टिलेजेस हैं, तो जहाँ ज्वाइन करते हैं वहाँ प्रोमिनेंट स्वेलिंग हो जाती है. यहाँ पे स्वेलिंग है, यहाँ स्वेलिंग है, यहाँ स्वेलिंग, यहाँ स्वेलिंग, तो एक नेकलेस टाइप का बन जाता है दोनों तरफ. एंड दैट इज ऑन द रैकेटिक रोजरी. Then there may be kyphosis, an extreme forward bending of thoracic spines or vertebral columns. There may be scoliosis, lateral curvature of the spines. Sometimes there may be kyphoscoliosis, yani both kyphosis and scoliosis, forward bending as well as lateral bending. There may be pelvic deformities. Then bowing of the legs and arms. ये legs bowing हो जाती हैं, arms भी bowing हो जाती है. Then there will be broadening of the wrist, elbows, knees, and ankles. They are broad wrist joints, broad or wide elbow joints, wide or broad knee joints, wide or broad ankle joints. And Harrison sulcus, ये यहाँ पर इस तरह से due to this due to pulling of the diaphragm inwards, there may form a groove in the rib cage, and it is the Harrison sulcus. तो ये इसके साइंस हो गए, कॉम्प्लिकेशंस भी हो गए एंड सिम्टम्स भी हो गए. स्टंटेड ग्रोथ, odd shaped skull, prominent skull, spinal deformities, kyphosis or lordosis or sometimes scoliosis, rachitic rosary, and pigeon-shaped chest and collapse of the chest wall, wide broad elbow, wide broad wrist, pelvic deformities, wide knee joints, wide and broad ankle joints, bowing of the legs and bowing of the arms. These are the important features of the rickets. ये सब वही रिकेट्स के फीचर्स हैं. बोनी नेकलेस टाइप का ये रैकेटिक रोजरी दिखाई पड़ रहा है और यहाँ पर बोइंग ऑफ द लेग्स, बोइंग ऑफ द आर्म्स है, अपर आर्म्स. ये नॉर्मल बोन्स दिखाई पड़ रही हैं और ये रिकेट्स चाइल्ड की बोन्स दिखाई पड़ रही हैं, बोइंग लाइक दैट. Now what is the investigation prevention? If you do blood tests, there will be low vitamin D in the blood, low serum calcium. X-rays show various deformities. How to prevent? Exposure to sun rays is very important. Ultraviolet rays is very important, and minimum daily requirement of vitamin D is 2.5 milligram or 100 international unit. Standard daily requirement is 10 microgram or 400 international unit. Cod liver oil, fish liver oil, etc. also should be given. Diet should be with adequate calcium. The milk has a lot of calcium, etc. to be given. So investigation and prevention. Treatment of the rickets. Vitamin D ergo calciferol can be given 50,000 international unit once or twice a week for 6 to 12 months. If renal disease is also present, then 1-alpha hydroxycalciferol, hydroxycholecalciferol, 1 microgram daily or 125 dihydroxycholecalciferol DHCC may be given. Calcium gluconate, calcium lactate may be given. Diet should have high protein and low fat diet. Diet should also be high in the calcium so that 1.5 and 2 gram calcium intake per day has to be maintained. And in cases of GIT disturbances, 15 gram calcium intake per day should be there. If tetany is also present, यानी calcium level अगर 6 milligram per 100 ml से भी कम हो गया है, normally 9 to 11 milligram per 100 ml होता है calcium, 6 से भी कम है तो tetany develop हो जाती है. So injection calcium gluconate 5 to 20 ml 10% solution slow intravenously has to be given, and underlying cause should be treated as well. So this is quick revision how vitamin D is फॉर्म्ड एक्टिव 125 डायहैड्रोकोलेस्ट्रॉल स्किन से, लिवर से, किडनी से, इंटेस्टाइन से. व्हाट इज द रोल ऑफ द पैराथार्मोन एंड द फंक्शन ऑफ 125 डायहैड्रोकोलेस्ट्रॉल इज absorption of the calcium from the GIT into the blood and also absorption of phosphate from GIT into blood. In the rickets, if there is deficiency, in the children there will be rickets and the vitamin D deficiency. In adults there is osteomalacia. Rickets which is a bone disease, विटामिन डी डेफिशिएंसी क्योंकि हो सकती है, डाइट में हो सकती है, सनलाइट अगर नहीं है अच्छी तरह से, जीआईटी डिस्टर्बेंस है, रिलेटेड डिसऑर्डर्स हैं, प्रोलॉन्ग लैक्टेशन, फ्रीक्वेंट प्रेगनेंसी. और ये इसके साइंस है जो इंपॉर्टेंट याद रखने हैं. स्टंटेड ग्रोथ, ऑड शेप्ड स्कल, स्पाइनल डिफॉर्मिटीज, रैकेटिक रोजरी, kyphosis, scoliosis, pelvic deformities, bowing of the legs, and broadening of the wrist, elbow, and knee and ankle, and bowing of the upper legs, upper arm and lower arm legs. Harrison sulcus may be there. And these are the investigation. Vitamin D कम है, कैल्शियम कम है, प्रिवेंशन सनरेज और डेली रिक्वायरमेंट डाइट का वो होना चाहिए. एंड ट्रीटमेंट इज विटामिन डी आपको देना है, कैल्शियम ग्लूकोनेट दे सकते हैं, 125 डायहैड्रोकोलेस्ट्रॉल दे सकते हैं, डाइट अच्छी प्रोटीन फेट होना चाहिए, और इंजेक्शन कैल्शियम ग्लूकोनेट दे सकते हैं, अंडरलाइन काज दे सकते हैं. तो अंडरलाइन काज ट्रीट कर सकते हैं. दिस इज अबाउट द रिकेट्स. इन शॉर्ट यू हैव टू आइडेंटिफाई द रिकेट्स. तो इंपॉर्टेंट साइंस है, ये आपको जरूर याद रखना है. और हाउ कैन यू ट्रीट द रिकेट्स. तो लेट अस स्टॉप हियर. थैंक यू वेरी मच.